Hello, welcome again to class. Thank you so much again for staying tuned. If you've not subscribed and so far you've been watching and you've been gaining value, I wish you'd subscribe and follow. And also share the videos because I believe since you're gaining value, your friends can also gain value. Thank you so much again for staying tuned. Now, in the last class we started already with Marek's disease. In the previous class, we started by giving its name, calling the name Marek's disease, that it is from a Hungarian scientist who discovered it. And it's also a non-respiratory viral disease, spreads fast. Although this time, it actually causes paralysis, paralyzing the leg, the limbs of the birds. And it's a disease that affects birds like chicken, pheasant, turkey, quails, and the likes. Now, we also looked at the signs and symptoms that it affects the muscles, and when it affects the muscles, it affects coordination. So the birds tremor, they can't coordinate themselves. When it affects the lungs, it causes belabored breathing, they can't breathe well. Now, when there's tumor in the lungs, it affects belabored breathing. Tumor in the muscles is paralysis, and tumor in coordination, they can coordinate. And when the tumor also affects the eye, you'd have a situation where the eye is gray, and that is where it obtains another name of it called the gray eye. It's also called acute leukosis or foul paralysis. About 4 different names I've mentioned now. Now, we go ahead to today, what we have today. What's the causal agent? It is a house virus. There's something about the viral diseases. When it comes to treatment, we'll get to it again. Now, what is the mode of transmission? Now, most viral diseases, some are lodged or domiciled in the body fluid, like the blood, the urine, if it's not for animal. Now, in birds, like in chicken, you call uric acid, not urine, because in uric acid for birds you have the feces and the urine coming in one lump, so it is called uric acid. Now you have them as it's airborne, it is transmitted in air. There are droplets. A lodge is in the feces, the blood, and the saliva. However, when you have feces of the animal down, the virus, when the animal defecates or droppings of the feces, you see that from the dust, the virus, when it picks from the dust, it goes, or maybe any of the body fluid moves from dust into the atmosphere and then spread to other chicken around, and then it can be also lodged in the feathers of the animal. Now, looking at the treatment, like all viral diseases, they don't have, or till this time of filming, we don't yet know about definite cure for them now, but there's a way of managing them, and that's by preventing them 2 ways broadly. Number 1, by vaccination. Vaccination is introducing of the virus that causes the same ailment, but either in attenuated form or killed form. Now the virus, which is the health virus, you give to the chicken either a combination or one of the herpes turkey virus, which is also called HTV, and the rest vaccine. Now it's applied subcutaneously via the back of the neck. At the back of the neck, you grab them and it's injected. Usually when the birds are about 4 to 5 weeks of age, you repeat. Now there's something about it. Now let me get it clear. Marek's disease vaccine, the first one is given in the hatchery when they are day old, the first. Now this is actually when you repeat. The first one is given in the hatchery and it's you would spread them, like they spread it over there, and then it enters through the eyes and some other orifices of the face, of the body of the face, and then gets in. That is how to get it at day old. Then you repeat it at 4 to 5 weeks. Now, other things about it only. Now, there's something to note here. Note that the vaccine only prevents tumors from occurring and paralysis from occurring. It doesn't stop the birds from catching the virus in some cases, because when it's airborne and the bird is actually around others that have it, one that have been vaccinated may have the may have the virus but may not express it because it has been vaccinated against it previously. So that is it. It's going to prevent the tumor from growing in the muscles, which may cause paralysis, or the eye, which may cause the gray eye, or affecting the lungs, which may cause labour breathing. Now, what is the second option in preventing? It is one very major thing we talked about here several is biosecurity. Biosecurity refers to measures taken to ensure that diseases or pathogens are not spread from one farm to another or from one bird to another. Or you try and see that the birds are actually secured. By this, first of all, you have specialized clothes you wear in going into the farm. If it's a large farm, you have your foot deep before you walk in or go out. Anyone who visits other farm shouldn't visit your farm in the same day. Shouldn't visit your farm, and they shouldn't put on the same clothes. Otherwise, take your bath properly and then change up before you come into your own farm. Other things, you restrict visitors. I've already said that. Movement of bags or sack or trays of eggs and others. You take care of all those things. Make sure that your farm hands, especially young boys who work for you, your staff are not visiting your neighbor's farm. Try and caution them. If you're working in my farm, stay here. And this is especially, now this is the reason why we have some outbreak in the farm settlement. Because the farm hands, the boys who work for you, or the people who help you in the farm, most of them have friends in other places, so they go to visit them, or someone come, oh, quickly borrow me your this, lend me your this, lend me this, and then when you lend, the person returns. You've only just transferred one disease from one place to another. To this end, more often than not, it's preferred to site a farm in a place where you are not around people or in a farm settlement. If you can, site a farm away from a farm settlement if you can. Thank you so much. That is my thought. Some people believe you can stay in the farm settlement where you share it. But let me leave that to you. What do you think? Put that in the comment section. Is it good to have it in the farm settlement, your own farm, or to have it isolated where you don't have a fear of transmitting these diseases from one farm to another? Thank you so much for watching this video. Please put your comment. What do you think? Is it okay to site a farm around where others are, or to have your own farm isolated to prevent not just Marek's disease but other diseases? I want to thank you for staying tuned. Please, if you've not liked, please like. Please share if you gain knowledge. See you next class.